This video will review what heart failure is, what causes it, how to diagnose it, and how to treat it. Heart failure, or poor heart function, is when your heart is weak or stiff and does not deliver enough blood, oxygen, and nutrients to the rest of your body. This can result in symptoms of heart failure. Heart failure is a chronic condition for which there is no cure. However, there is a treatment. Heart failure is sometimes referred to as congestive heart failure, since it can cause excess fluid to build up in certain areas of the body, such as the legs, lungs, and the stomach. Diagnosing heart failure can be done by your primary care provider, such as your family doctor, though it can also be done by a cardiologist or another doctor. One of the ways heart failure is diagnosed is with something called the ejection fraction, or EF for short. The ejection fraction is the percentage of blood that is pumped out of the heart with each beat. A normal ejection fraction is around 60%. Knowing the ejection fraction can help your provider to understand the type of heart failure you have and also how to best prescribe medications. The following tests are some examples of how to obtain your ejection fraction. Heart failure does not develop overnight. The condition progresses over a period of time. It is chronic in nature and is progressive, meaning it will get worse over time. There are many causes for the development of heart failure, and you may have more than one cause for your heart failure. Heart attacks are a common cause. Some other causes include diabetes, certain viruses, valve disease, pregnancy, the use of alcohol or the use of drugs, certain chemotherapies, and high blood pressure when it is not treated. This list does not include all the possible causes of heart failure, as there are many. Heart failure has many signs and symptoms. You may experience any number of these symptoms due to your heart's poor functioning. Shortness of breath, fatigue or lack of energy, swelling of the feet, ankles, or legs, or swelling or bloating of the stomach, a dry or wet cough, lack of appetite or feeling full very quickly after eating small portions, difficulty laying flat or sleeping due to trouble breathing or having to urinate, and troubles with memory and remembering details or instructions. It is important to know that heart failure does not mean that you have had or will have a heart attack or myocardial infarction. It does not mean that your heart will continue to fail, and it does not necessarily mean you will need a heart transplant. Caring for heart failure requires a combined effort between you, your family members, and your care providers. You will be prescribed medications to help control and treat your heart failure, but there is a large lifestyle component that can help with the management of your heart failure. Managing heart failure, both with medicines and lifestyle changes, are meant to improve your symptoms, improve your heart function, and potentially improve your ejection fraction. In addition to medications and other lifestyle recommendations, your care team may also recommend treatments that include other tests, procedures, and potentially a cardiac device such as a defibrillator. Everyday management is important and involves you following recommendations from your care team. That includes dietary modifications, such as following a salt and fluid-restricted diet, watching your weight and fluid retention symptoms, monitoring blood pressure, and being regularly active. If you smoke, you will be encouraged to cut down or quit. If you consume alcohol, you may be asked to modify your intake according to recommendations. The next video will go into lifestyle management a little bit more in depth.